Going to the dentist, a cause of anxiety and fear for many Americans. But why? Dental anxiety and fear are major contributors to America's poor dental health epidemic. According to hypnodontist Juan Acosta from San Diego, California, there are many causes for dental anxiety.
You know, dental anxiety is one of those things that attacks a lot of people, most of the population, I would say. But the reasons are what's interesting. Some people are anxious about the actual needle or the pain that they might feel, but a lot of times people are just embarrassed to show the dentist their mouth, which is really surprising.
In his medical hypnosis practice, Juan helps patients take the suffering out of their visit to the dentist. This morning, certified hypnosis practitioner and colleague Dave Berman from Arcata, California, will be sitting on the dentist's chair for a dental procedure, using nothing more than hypnotic anesthesia.
We have a part of our brain that registers sensation, and then we have another part of our brain that registers an emotional response to the sensation. And so I'm going to choose not to have any emotional response to the sensation. I just won't notice it, and it will be all controlled by my mind. And when we're through with the procedure, there won't be that usual period where chemical anesthesia has to wear off and you feel like your face is bloated or you don't have full command of your tongue. All of that will not occur for me. I'll just be wide awake and comfortable the whole time and get up and walk out, no problem.
Dave and Juan have had 2 sessions together over Skype in preparation for the procedure. Today, Dave says they're here to walk the talk.
Well, I'm a clinical and medical hypnotherapist, and it's important to me to walk the talk and to educate people about the many varied applications of hypnosis and what is possible by using the mind-body connection. You know, it's always on. Our mind is always influencing our bodies.
So the treatment Dave is having today is called scaling and root planing. What it is a treatment for patients that have what's called periodontal disease. You can have really moderate periodontal disease or mild, and they want to be numb because they want to be comfortable. No one likes to be numb. No one likes getting the shots and everything, but they do want to be numb because they know that they're going to be going deeper than the normal cleaning.
So you normally do anesthetic for this?
Oh, all the time.
But Juan and Dave are confident in what they're about to accomplish.
Because hypnosis works on expectation, and Dave expects to feel only comfort throughout the procedure. So all we're doing today is helping him fulfill that expectation by allowing his mind to focus on something else. And he's a trusted practitioner, and I'm a professional, so that's why I'm confident.
Juan will now spend a few minutes guiding Dave into a comfortable hypnotic state.
Feeling inside that we were talking about, that sort of sense of overwhelm and that drop, that release. Just imagine how awesome it's going to feel when we leave this office today. And you have felt only comfort throughout the whole procedure.
After about 5 minutes of pleasant suggestions, he signals to the staff that Dave is ready for the treatment. Hygienist Stacy has agreed to let them film today's treatment.
First, I'm just going to look at neck.
Letting every little sound simply become a tune of comfort.
Dave appears very comfortable, and since he won't be able to talk, he will give a thumbs up when Juan asks about his comfort level during the procedure.
And simply allowing all the feeling.
So far, so good. 1 hour into the treatment, everything seems to be going as planned, but there's still 1 more hour to go.
My thoughts seem to kind of go in cycles. I didn't stay on one thing for any really extended period of time. I would pay attention to my breath for a while, and then I would lose track of that and focus on my hands and just notice how relaxed they were, and then I would get kind of an image in my mind of the tools in my mouth and where they might be poking me, and just a sense that I can feel that, but it's not painful, it's just a sensation.
You'll be feeling fantastic. I think I'm going to sit there next.
After treatment, they talk about what this means for hypnosis as a major player in the dental and medical fields in the coming future.
He didn't flinch. He was completely fine. He listened to me, and he was completely relaxed. So That's all I noticed. I mean, most people would be flinching or clenching or telling me, hey, I'm feeling this. Can you get this area numb again?
Dave seemed to respond very well to the hypnosis. He was relaxed. He didn't flinch. There was no movement, no real noticeable sensation going on. I did notice when I asked him sometimes to give me a thumbs up that he wouldn't. But a lot of times that happens when people are so relaxed. I knew that he was responding because he was able, when he felt something, he was able to tighten up his fist, and I was able to come in and help him relax through that. But I think he did fantastic throughout the procedure. He's ready for next week to do it on his own.
Absolutely. And I will do this again next week for the right side of my mouth with the same approach, just on my own.
Dave and Juan are just two among the growing number of people who choose the natural approach over the chemicals any day. For more information, contact the practitioners directly. Until next time, 1, 2, 3, 4, 5, wide awake.